to our first official episode of Symmetrically Fit. My name's Dustin Gotro with Symmetry Personal Training. I've got Katy Girlinghouse with the Fit Pelvis. Say hi, Katy.
Hi.
And I've got Dylan Stone, the DMI guy, with us today. Say
Well,
hi, Dylan.
oh, hi.
All right, so we'll get back to those guys here in just a minute with some full introductions. I know I kind of briefly talked about them last time, but we'll let them give you all their info today. First off, we need a few favors from you guys to kind of get this thing going. So, first thing, we need you guys to go to our YouTube channel, Symmetry Personal Training, and subscribe and share. That's where our main platform is going to be for this podcast. I'll let Katy and Dylan share all of their info as well because they will be posting as well. So you guys can subscribe and share there as well. On Facebook, we need you guys to go to Symmetry Personal Training page and follow and share that page. All of our updates for new upcoming episodes, conversations about topics that we're going to cover or that you guys want to cover will all be done on that Facebook page. Same thing, I'll let these guys share their information as well, so you'll have all of us all the way around. Most of all, we need you guys to share. We need to get some more people on here. Our main goal with this thing is to educate, so we need to get as many people out there as possible. So kind of getting into that, the goals of the podcast. We want to educate you guys on pretty much anything health and fitness, but kind of some specifics. We want to dismantle a lot of the myths and misconceptions that we see in the industry. This whole thing kind of came up with us having conversations about these things, and over time we kind of realized, you know what, we need to be getting this out there and teaching people this. Otherwise, it's always going to be this way where a lot of people just don't know. There's just not the good information out there. So another thing we want to cover is helping you guys as listeners identify what may be holding you back. So whatever you're working on with fitness, if you're hitting a plateau, you're not losing weight, not gaining muscle, bring those things up to us and we'll kind of put some information out there and see if we can't help you figure it out. Most of all, and this is for all three of us, I'll let these guys touch on this as well, but most important to all of us is teaching you guys that the foundation of everything fitness is proper movement. We all have our individual specialty areas that we work on with clients and patients, but overall our goal is the same. The foundation is teaching proper movement, making sure your joints are moving properly, making sure muscle imbalances are corrected before you start going all out, trying to get in shape. So not just jumping into the gym and going straight at it. We gotta get things moving right first. You guys have anything to add to that before we get into introductions?
No, I think that's great. Yeah, we just really want to take down those myths that we hear all the time and give people better information.
Yeah, I think
Absolutely.
understanding is definitely the basis for everything we do. So we not only want to understand more, the three of us, I think we've shown through our careers that we're very driven to understand things and then also drive others to understand it as well.
Yeah. Good stuff. So we're going to get into introductions so you guys can kind of get to know who Katy and Dylan are a little bit more, and hopefully you guys will follow along with these episodes and you'll learn more and more about us, and we'll start there. So let's start with Katy. Tell everybody about yourself.
Yeah. Hey, so I am a doctor of physical therapy. I own the Fit Pelvis here in McKinney, Texas. But my practice focuses on pelvic health. So we work on bladder function, bowel function, sexual function, and then pain throughout the body. So we end up seeing people with a lot of chronic pain, who have developed some dysfunctional movement patterns over years and years. And we're breaking down those patterns and getting them moving better, getting them back to the activities that they want to do. But really my passion is helping people stay active in whatever that looks like for them, and making sure that they are heard and get results, because so many of the people that we work with get told that their problems are normal, they just have to deal with it, they had babies, and it's just part of life now, and that's just not true.
Awesome. That actually brings up a question I think people need to hear. So I know you deal with pelvic health. So that being said, you deal with a lot of women. How
Mm-hmm.
important do you feel it is for men to realize that they also have some issues with their pelvis sometimes?
Yes, I think that's so true. Men don't think they can have problems because they're men. Um, but usually when I see men, it's because they've had pain for years and years, and now it's affecting their sexual function. That's when they start seeking help. But they've had symptoms where they've had urine leaking, or they have difficulty emptying their bladder, or constipation. And those were early signs that there was some pelvic floor dysfunction, and it just got worse and worse and worse. And now they're miserable. So yeah, men can have pelvic floor dysfunction. They can have pelvic health problems, but really, I mean, we're looking at the hips, we're looking at the low back, we're looking at abdominal muscles, coordination, control, everywhere from, rib cage down through hips, knees, and feet. So, yeah, men need to know that they they can have problems too.
Okay.
And that's
That actually wasn't on the agenda. It just kind of popped up, but let's get into that more later. That's important, I think. All right. So back with Katy. What's the most common muscle imbalance you see
Yeah.
associated with back pain?
Do you want to let Dylan introduce himself first?
Yeah, we can get into
all right.
questions after. Who
Oh,
are you,
sorry.
Dylan?
Katy over here just calling the shots, letting us know
Yeah.
Hey,
what to
I'm
do.
fine with that.
All right. Well, hey everybody. My name's Dylan, and I. So originally, Dustin and I, about a little bit over 10 years ago, if you can believe it, Dustin. We got
A long time.
into. Well, I got into fitness with Dustin. We worked at a CrossFit box. He went on to own a CrossFit box, and I was the general manager there. And there, I was kind of. Of course, you see all this stuff on. It's even more pervasive now, social media and misinformation, and some people meaning well, but they just don't have the information. And it's like all this information out here, and I just thought, man, I need to get down to the bottom of what fitness is, and so that's why I went on to physical therapy school. I got my doctorate just like Katy did. But I took a little bit of a different path from there. So directly from PT school, I went into pediatrics, specifically home health pediatrics. So I see a lot of kiddos who are lower level, kind of neurologically involved or genetic disorders. And then I went on to found and start my own practice. The DMI guy stands for Dynamic Movement Intervention. I'm hoping there will be room in a future podcast to get into that, but it's a new kid on the
Definitely.
block kind of thing, and there's very exciting research about it, but that's for another podcast. But that is pretty much where I am. I stick a lot with peds and neurology, and what I hope to bring to this podcast, my insight is kind of the biomechanics of everything, how muscles pull on bones and structures, and really get down to the basis of how healthy movement occurs.
Awesome.
Mm-hmm.
All right. So back to Katy, and I want to actually add a little more to this question. So as we know, back pain is, I would say, the most common issue we see with patients and clients. Even if there's other underlying issues, back pain just seems to be like something everybody has experienced at this point. And I think as we're getting more and more into all this technology and phones and social media, it's just getting worse. I mean, it's every single client I have has had back pain at some point or still has it. So that being said, what are the most common imbalances you've seen associated with back pain?
So a lot of what I see with back pain is core weakness or poor activation of the core. So we talk about bracing and getting that deep transverse abdominis active. A lot of people are using their breath to activate the core, as opposed to a true concentric muscle activation. So we're often looking at core coordination with the abdominals, pelvic floor, and the back muscles. And then from there, the other piece I see is overactive and tight hip flexors. We got that. And then a lot of people think they have tight hamstrings, but that's usually not a problem. And so a lot of times we're looking at core strength and overactive hip flexors because of that core weakness that's lacking there.
Okay. Talk to me a little more about breathing in general. I think people need to hear that, the importance of breathing when it comes to fixing these issues that cause back pain.
Yeah, so when you're breathing, you should get a good pelvic floor and diaphragm movement. So the diaphragm should come down as you inhale, make space in the lungs for movement, and your pelvic floor should come down and they should match that movement. And then your abdominal wall is going to expand as well. And then all of that is going to shrink back in. So pelvic floor and diaphragm are going to move up. Abdominals are going to activate. Your deep back muscles and that deep core are going to all activate. And so that together is going to give you stability in the spine, pelvis, ribs, thoracic spine. But it is also going to change, like if that is off, then you're going to put more pressure on the discs. You're going to put like dysfunctional pressure on different parts of that system. And so then you won't be able to get a good core contraction to give you the support.
Awesome. That's good stuff. And so that's what you see, I would assume, with a lot of your patients that are having back pain. Is it pretty much always they've got some kind of dysfunction with the breathing?
Honestly, I see it with everyone, even
Yeah.
if they're coming in for like a foot problem. Yeah. A lot of
I know
people,
you found it with me.
yeah, a lot of us tend to be like apical breathers. We breathe into our shoulders and not
Mhm.
into our rib cage, into the lower part of the rib cage. So we're not getting a full breath and we're not getting that pelvic floor and diaphragm movement. When you breathe into the shoulders, everything in the rib cage just tightens up and you don't get movement. So yeah, it is something I work on with pretty much every single person, retraining the breathing pattern and getting everything moving better, because that opens up the thoracic spine, which also takes pressure off lumbar.
Awesome.
Hey, Katy, I had a question for you. So this, I mean, feel free to say it's a whole nother podcast episode because I feel like we have a lot to talk about with this. But for stress incontinence, and for those listeners who don't know what that is, it's when you bear down and then you urinate a little bit. How much of that, in terms of postpartum women, is it like, oh, it's just going to happen because you had a baby, or is it something that can be addressed and treated in most women?
0 of it is normal.
Okay.
Um,
I was hoping you'd say
and
that.
yeah. Well, because what you hear all the time is people say, "Oh, I had a baby, like it's fine, it'll go away," or "It's just part of life now." But stress incontinence is never normal. And yes, for everyone, we can work on it and get it better.
Okay, that's a tip of the iceberg for a next podcast, right, Dustin?
Yeah, that's a whole
Yeah,
thing. Yeah.
we're definitely getting into that. I
Yeah.
like that.
Mm-hmm.
Those are interesting. Okay, so let's go to a question for Dylan. So with you, Dylan, you're working with mostly fairly young kids. So tell us a little bit about what that looks like. I think that's like a kind of a new realm that a lot of people don't know anything about.
Yeah, it definitely is. So it's something that a lot of kids don't need services for physical therapy so young, and that's why it's so not well known. But the kids who do need it, they benefit a lot from it, right? So what it looks like, let me give you an adult example first. So when I was doing my rotations with adults in hospitals and whatnot, A lot of the tug of war was, I give you these exercises and I say, if you do these exercises, you'll get better. And then they don't do the exercises. And then it's like, okay, well, let me try and solve this problem again, even though you're not going to do your exercises. With kids, it's a little different. So kids need, I'm not going to say all kids, most kids need zero motivation. They want to play, they want to explore, they want to do all these things. My job is to set up the environment for them to play. So probably one of the most common things I do for a kiddo who's just about to start walking, like around a year to a year and a half. Most kids would pull up onto a couch and just start cruising or walking on side to side along that surface. But if they have some sort of weakness or imbalance, all I do is I take my hands and I support the hips, and that allows them to step sideways. So it gets them to the point where they can start exploring their environment, and then the physical development starts to come. So instead of me giving them exercises, I just I set up the environment so that they can explore independently, and then that kind of brings about all the gross motor development. Yeah, that's pretty much where pediatrics sits right now.
So it sounds like it's almost like little games essentially worked into the
Oh,
therapy.
oh yeah, I get paid to play with kids all day. That's pretty much what I do.
Awesome.
So yeah, it's
That's cool.
a lot of things, and the cool thing is that I get to be very covert about it, and I get to kind of hide my therapy inside of games. And so from an outsider perspective, it's like that guy's just playing the game. The guy's just playing games with kids all day. But in reality, there's some therapeutic reason I'm doing that game. I'm just trying to not let the kid know that, because then they're gonna resist if they think they're doing exercise rather than playing a game. So yeah,
I think that's a really cool concept too, because I feel like it probably teaches them to find the fun in things that normally wouldn't be fun otherwise, right?
Yeah, it's I mean, yeah, I wish I could hand a 2-year-old a sheet of paper with exercises on it and say, do these exercises. But it's about showing them that there is a way they can do the milestones that they should be doing at that point. And then once they put the two and two together that they can do it, then they'll start doing it on their own. So yeah, it's a whole lot of, I'd say that I have an unofficial degree in child psych, because I have to kind of get in their brain and figure out how to get them to do stuff.
How was it? So I started in peds right out of school, and that is a skill.
Yeah.
Like,
Yeah. It's being childish.
Maybe we gotta incorporate that concept with adults. It might work better.
Yeah.
I find a lot of my adults don't do what I tell them most of the time. That's the toughest part.
Yeah.
Okay, so back to Katy. So the physical therapy industry in general, I know, is highly competitive. It seems like they're everywhere these days. So, and over the years, I've worked with a lot of different physical therapists, personally and partnered for work, as I was associated with different gyms, things like that. And I gotta say, since I've been working with you, it's two things. One, you're very genuine, and you actually you're honest about what you know and what you don't know. And if you don't know it, you go and figure it out. Um, I think that's a rare thing, but also, as a businesswoman, your business has been incredibly successful. So, what would you say makes your clinic stand out, and why have you been so successful in such a competitive industry?
yeah, I would say, as a PT, one of my biggest goals is for people to feel heard and for people to understand their own bodies, because I can't follow them around all the time and fix the things they're doing, change their movements, smacking their hand when they're doing the wrong thing. So I need them to understand their own body, and they know their body better than anybody else. So I can give them the tools to change a movement pattern, to understand when pain is beneficial and when pain is not, and the differences in how those things feel. And then give them the opportunity to make decisions for themselves and say, hey, like this isn't feeling right today. I need to back off. I need to do a little bit less. Or this feels more like a stretch versus pain. This feels like a muscle working versus pain. And I can push a little bit more. So that's one of my biggest things and always a priority with everyone that I work with. And then in our clinic, we really focus on whole body. So what is everything doing in the system? Because we can't treat a shoulder or a hip in isolation. It's connected to the rest of you. So we need everything to be moving well in coordination. And we spend an hour with our patients one-on-one. So we're not giving you 10 exercises and you're doing them in the corner by yourself while I go talk to someone else. We are sitting there making sure that that movement looks correct, that you're understanding why we're doing this exercise, that we are educating throughout the process, making sure that everything is moving well, and we're seeing the changes that we want. So because I spend that whole hour with someone, I can make changes every single session. I can do my hands-on treatment, which might be several different things, but I do some hands-on, and then we follow it up with a corrective exercise, something to make that hands-on more beneficial so it carries over session to session. You see gains even between the visits, and to make it longer lasting so that you don't come to physical therapy for a month and you're like, I'm great. And then you stop, and a month later, that pain is back. Right. That's what we see so much. And with our patients, we don't see that nearly as often because we really are addressing the underlying problems and not just that pain.
Awesome. And one thing I want to mention that I meant to mention earlier, I forgot. Just so you guys know, as listeners, Katy and I have partnered together. So I train her at the gym. She does all my physical therapy. Dylan and I are workout partners. So we do a lot of our programming together based on how our bodies are doing, what needs to be changed to avoid injuries, or if I keep overdoing it and he has to back off of certain things.
That's what I was about to say. I'm there.
Once in a while.
I'm there with a leash, keeping you from maxing out every day. So
every once in a while, it's not often. So just so you guys know, when I say Katy is genuine, I'm not just saying that. I've experienced it myself as a patient of hers, and things she's been able to do that I've been trying to figure out for 20 years as a corrective exercise specialist have just been absolutely incredible. And same with Dylan, his ability to break down biomechanics, just watching a movement when I'm working out, and just kind of remind me on certain things that I need to be adjusting and watching for, has been absolutely incredible. So just wanted to throw that in there real quick.
Mm-hmm.
So back to Dylan for one last question. Obviously still focusing on working with pediatric. With working with kids, why do you feel it's so important for kids to start this at an early age? Obviously, for the kids that need it, like you said, it's not all kids, but why do you feel that's so important? I think that's something that people should know, should hear.
Sure, absolutely. So, what I'd say to that is that we have, as children, from let's say 0 to 8 years old, there are periods of time where we make huge jumps in development. So, one stage is 0 to 2 years old. Obviously, you go from being this tiny little baby to 2 years old. You're walking, you're jumping, you're doing all this stuff. So that's a huge jump in development from 0 to 2 years old. And then again, when we hit puberty, there's another huge jump in development where coordination may go down and strength may go up, and hormonal changes occur, which could lead to differences in muscle elasticity and things like that. So you think about all these changes that kids go through, and then you add on top of that some diagnosis, Down syndrome or cerebral palsy or spina bifida, and that gets a lot more complicated. So what we do, and the reason why we want to intervene as early as possible, is because we want to get them back on the trajectory that they need to be on, right? So it's just like a domino effect where say a patient with spina bifida because of, for those of you who don't know, it's an abscess or a growth on the back, right on the spinal cord. So it's a bulge from the spinal cord. Obviously, if you have a bulge from your spinal cord, you're not able to roll very well, right? And so if you miss that time when you should be rolling, then you're going to miss the next milestone, which would be, pushing up on your arms when you're face down. Then if you miss that one, you're going to miss the next one. You're going to miss the next one. You're going to miss the next one. So we try and intervene as quickly as possible, especially if they're under, 5 years old. We intervene as quickly as possible. Actually, the practice that I work for right now, there's a special designation. It's called high risk infant. And so if you're under a certain age or you have a certain diagnosis, that gets put on your chart that you're a high risk infant, and you immediately get processed through the insurance process. I guess that's the best word for it, because research shows, right? It shows that if these high risk infants don't hit these milestones, they're going to keep falling behind, and then they're going to need even more therapy, possibly surgeries in the future. So that's what I always educate parents is, if you have any shadow of a doubt that your child needs therapeutic services, needs any sort of intervention, get them assessed, because I'd much rather say, hey, your child looks fine. They're going to develop just fine, rather than coming in 2 years later and being like, ooh, we should have started 2 years earlier, and then having to play catch up in that way. So early intervention is always best.
So on that note, what are your thoughts on when patients go to their pediatrician, the parents go to the pediatrician and they say, hey, I feel like my kid is delayed or they're not doing this well, they're struggling, I just have some concerns. And the pediatrician says, oh, they're fine, we'll wait and see.
Yes, the wait and see. So that's always a difficult one. What I'd recommend to parents who have the wait and see pediatrician is look up what the milestone should be. Look them up, from reputable sources. Like CDC has milestones on their website. And if you think your child's not hitting those milestones, then get a second opinion from a pediatrician. So I've just in the course of my practice, I've talked with a lot of different pediatricians, and they all have different ways they approach children who are a little bit behind, right? Where there's no big scary diagnosis. It's just the child's a little bit behind, right? And they all have different ways of approaching it, which is their right as a physician to do that. So if you don't agree with your pediatrician and on the wait and see, then go get a second opinion. That's also your right as the parent to get a second opinion. Then you can rest easy in the fact if the second pediatrician is like, they're fine, right? Then you can rest easy in the fact that you have two people saying that your child's fine. Mm-hmm.
And I think too, I don't know if you see patients directly, but in the cash world, we can, a little easier.
Mm-hmm.
Like we're the movement specialist, so it never hurts to call a PT and say, hey, can you just evaluate my kid?
Mm-hmm. Yeah. So it's definitely a move that way. So yes, in Texas, this is a whole nother podcast episode here. Direct access. So in Texas, if you want to use insurance, you have to go to a physician first and then a physical therapist. And there's certain other special cases, but there's not enough time. But what a lot of pediatricians are doing now is if they have a hint of a delay, they will just refer to us, to physical therapists, and they'll let us assess because they kind of realize that we're the movement specialists. So I'm getting a lot of evaluations where the child looks great. They look fine. And it's like, I'm not going to get mad at the pediatrician for wasting my time. I'm going to thank them for allowing me to do my job, right? And allowing me to make sure that child is on track to do what they need to do in the future. Mm-hmm.
All right. So we're going to kind of switch gears real quick. I originally planned on these podcasts being about 30 minutes. We're going to go over that. So if you guys have the time, we'll probably go to about 45 minutes or so.
Sure.
I do have to get back to the gym here in a little bit, but I want to make sure we cover a few really important key things So we're going to kind of get into stretching the hamstrings. This is going to be a long, long process. We're going to go through a lot of different things associated with back pain, and obviously this is definitely related to back pain. But I do want to get to some key things today. So the main thing is, and this kind of came up from me seeing ads on Facebook actually, of different programs and stretching apparatuses for the hamstrings. And I don't think a lot of these companies, I don't think they have a bad intention. I think they mean well, but the wording that's being used, I think, builds a misconception due to the fact that the general public is not fully educated on some of the things we're going to talk about today. So we're going to kind of get into that. So first off, and this is kind of for all of us to discuss a little bit, why is it so common that when people have back pain or they have an injury in sports, they pull a hamstring, they go straight to stretching the hamstrings? Where did that come from?
I think part of it is stretching feels good. Like, I
Yeah.
think that's a piece of it. It feels good. And I think there's just outdated information where people used to think that everyone had tight hamstrings. Hamstrings are attached to the pelvis, which is attached to the back, so we should stretch those. And it's just old, inaccurate information.
Yeah, I think it's so this is going to be it's going to make a lot more sense when we have the diagram and align it, but the typical hamstring stretch is also a back stretch. And so and if that back is, if it's tight or if it's malaligned and you stretch the back, it's going to feel good. So you're like, "Oh, this hamstring stretch makes me feel good," when in reality, the hamstring stretch is getting the lower back to stretch a little bit as well. So
Okay. Yeah, that both of you guys kind of touched on what I was going to say. I think the biggest issue with it is, like Katy was saying, it feels good, right? So if the back hurts and we stretch the hamstrings, it makes the back feel better. So that's kind of where I want to start is getting into why that is. So first off, I want to talk a little bit about the difference in when a muscle is tight and when a muscle is shortened, right? So every muscle in your body, the nervous system has kind of a blueprint of how long that muscle is supposed to be physically, how much tension it's supposed to have on it to be able to move the body properly. And I think this is the misconception. When we hear tight, when we think tight, we immediately think that muscle needs to be stretched out. It needs to be lengthened. And that's where I feel the big misconception is. We have to remember that when we say a muscle is tight, we're referring to the actual tension in the muscle. So if you have a muscle that's supposed to be a certain length and it's been overstretched for 10 years because of a muscle imbalance, that muscle is going to feel tight. There's a lot of tension on it because it's stretched out further than what it's supposed to be. So yes, it's tight. However, if we go and stretch it out and lengthen it, we're only increasing the muscle imbalance. So it's actually doing the complete opposite of what the fix is. So we that's the biggest thing I think we need to establish is there's a difference in a muscle that's shortened to a position where it's shorter than what the nervous system knows it's supposed to be, and it's not moving properly, and it's tight because it's lengthened out. So there's a big difference there. So I want both of you guys just to kind of put your input in on the difference in a tight and a shortened muscle.
Dylan, you want to jump in there first, or you want me
sure,
to?
yeah.
Go for it.
So really this is, and I'm only a few years removed from PT school, so I remember it vividly, learning this concept, and it melted our brains because we're trying to wrap our head around tight versus loose and lengthen versus shorten, right? So there's two different spectrums you're talking about. There's tight, loose, shorten, lengthen, right? And of course, you would think like as you tighten a muscle, it shortens, right? That may be true in an active motion. You see me doing my biceps. Like as I tighten my biceps, it shortens, right? Well, that makes sense. But we're talking about postural. Like we're not talking about active movement. So what my favorite way to explain it is that tight and short or tight and loose are independent of short and long. You can have any combination of those four, and they don't necessarily, there may be patterns, but you can have any combination of those four, and you have to parse it out which one you are in each spectrum and then address it from there. Yeah.
Yeah. So what I teach my patients a lot, because they do think I need to stretch my hamstrings, but they're tight, they're not short. And so if we're stretching a muscle, it should be measured short. So you need to know what the normal range of motion of that muscle is. So I'm going to use my arm for example here. So if we think about like a bicep length here, to get full bicep length, we should be able to fully extend our elbow and our shoulder. If you don't have that full range of motion, the muscle may be short. If it is tight, you may have full range of motion, but it just feels tight. And I know, especially in peds worlds, but tone, muscle tone and neurologic input is going to drive the tension as far as the tightness or looseness more than the muscle length, which is the shortness. And so when I decide whether I want someone to stretch, I am measuring the length of that muscle, not going off of their feeling.
Mm-hmm.
Yeah, I think that's an important point there. The distinction between the physical part and the neurological part, right? When I think, okay, there's a muscle that's overactive, I'm thinking nervous system. We need to relax the nervous system. We need to calm down the neural activity, not necessarily stretch the muscle out and lengthen it. So there's a big difference there. And I think the nervous system is the part that a lot of people just kind of don't realize is part of that whole muscle imbalance. So Dylan,
Mm-hmm.
break down for the listeners the muscle imbalance as pertains to what we're just talking about when we're looking at an anterior pelvic tilt.
Mm-hmm.
And I'm going to share my screen here
Okay.
to show everybody exactly what we're talking about with an anterior pelvic tilt. Kind of break that down for the listeners
All right.
in terms of short muscles and all that.
Mm-hmm. All right. My answer is going to be an hour and 15 minutes long. There will be no lunch break. I'm kidding.
All right, we're recording.
No. All right. So, what we're going to talk about, right, is how tight and inhibited muscles lead to an anterior pelvic tilt and also lead to back pain, right? What I'm going to reference is what's called Yanda's lower cross syndrome. For all of you who have some kinesiology background or kind of know what I'm talking about, we understand that it's more complex than this. There are more systems at play here. But in terms of the context and what we're talking about right now, this is using Yanda's lower cross syndrome as a framework is a good starting point. So we consider four muscles or four groups of muscles with Yanda's lower cross. Dustin, is your cursor working? Can you point things out?
Yep.
Okay.
Yep.
So we have the quadriceps. And give that a good old circle somewhere. Or is it working? I don't know. I can't see it. Anyways.
For us,
yeah.
Okay, so there it is.
There we go.
All right, so we have the quadriceps or the thigh muscles, right? We have our abdominal muscles, our core muscles, right there in the front. Our back muscles, we typically talk about erector spinae or paraspinal muscles, or quadratus lumborum, but there's going to be a test on this later. And then there's at the very bottom, there's hamstrings, right? And that's everyone's favorite headline muscle, hamstrings, right? Okay, so we have these four different groups of muscles, and they're all attached to the pelvis, right? And so what we do, I love this picture because think about the head of the femur. Can you give me a circle on the head of the femur? Give me a little a little notation there. So the head of the femur, consider that the pivot point, right? So the pelvis rotates around the head of the femur. There it is. Yep. Okay, so now we can think about these 4 different muscles as pulling on the pelvis in a certain direction, right? So if the quadriceps pulls on the pelvis, it's going to tilt it forward, right? If the abdominals pull on the pelvis, it's going to pull it backwards. If the back muscles, the erector spinae, quadratus lumborum, pull on the pelvis, it's going to pull it forwards because it's attached to the back, so it's going to tilt it forward. And then if the hamstrings pull on the pelvis, it's going to tilt it backwards. So we have 2 muscles, 2 groups that tilt it backwards, 2 that tilt it forwards. Ideally, if we are the perfect person, those balance out and we live happy lives and we lift as much weight as we want, right? But in reality, when we're sitting, just like I think the 3 of us are right now, we are stretching, we're putting those hamstrings in a lengthened position, right? So the hamstrings in the back, right? They're what should be pulling the pelvis back. But since they're being stretched, they lose their ability to pull on the pelvis. And so now we start tilting forward. And then also in this seated position, we start losing abdominal activation. That's why, when I first started getting into fitness, sitting on a Swiss ball was a big thing. Like sit on a Swiss ball all day at work, right? And tighten the core, right? The concept is sound, but that's a whole another podcast. There you go, another podcast for you, Dustin.
We got a lot.
So the abdominals get weak. The abdominals should pull the pelvis back, right? And so the hamstrings and the abdominals are both not doing their job, and so they can't pull the pelvis back. And so what the quadriceps and the back do is they allow the pelvis to tilt forward, right? So we have this big old anterior tilt or forward tilt of the pelvis. What hopefully I'm not the first person to tell you this, but the pelvis is attached to the back. And if the pelvis tilts forward, it's going to put an excess bend in the back, right? We want a certain amount of curve in our lower back, but if we have too much, we cause problems, right? So if that pelvis is pushing on the lower back to increase that lordotic curve, if you will, then we start getting into things like there may be different muscle issues, there may be disc issues that push on nerves, any sort of things where the lumbar spine is not in its ideal position. We start getting breakdown in those tissues and then can cause a myriad of problems. Well, there it is.
All right. So I want to make sure we have time to get through some really important stuff. So we're going to kind of blow through these next few things quickly. But I'm hoping from that explanation and from this diagram, listeners, you're starting to kind of get the idea of, okay, that's why when the quads are tight, when I'm sitting down all the time, when the hamstrings are lengthening, that's why it puts tension in the back and causes problems, as just a really general explanation. What I want to get into, and this is kind of the main point I wanted to cover today, and this would be for you, Katy, is now that we kind of understand this muscle imbalance that's going on here, this is the case for, I would say, 90% of people. Is that probably pretty close, right? Most people have this muscle imbalance to some extent. When we're in this situation and we go straight to stretching the hamstrings, Katy, why is that dangerous when you're already experiencing back pain?
Yeah, so like Dylan said, when it's already lengthened, it's not able to do its job and posteriorly rotate the pelvis. And so stretching that more is going to lengthen the hamstrings even more and take the tension off that is trying to posterior tilt the pelvis. So the muscle is getting weaker as you stretch and stretch and stretch, and not able to activate in that position. So hamstrings continue to lengthen. You get more and more anterior tilt, more and more of that lumbar low back curve, the lordosis. And like Dylan said, that's going to put more and more pressure on the lumbar spine. And so we get all of those, we get back pain, we get symptoms, things that are going on there because we're not able to correct that movement and get into a posterior tilt that we need for walking and squatting and like life, right? We need to get into
Yeah.
a neutral and posterior tilt at times. And if we can never get there, then the hamstrings are lengthened and not working.
Gotcha. So yeah, that's one of the big things I wanted to cover is, if you're looking at this is that tilt that we're in, we go and stretch this. What you guys are saying is that's going to put more compression right here in the spine and start causing all that dysfunction. So when you've already got, let's say we're in this position, we have a bulged disc. Now we go and release this a little bit more, get more lengthening. Then we just smash into that disc a little bit more. So it's essentially, I would say, greatly increasing the muscle imbalance and causing some pretty serious issues in the lower back. So I guess the main point on this one is if you're having lower back pain, I'm not going to say don't ever stretch your hamstrings, but go get assessed by a professional and find out if your hamstrings actually need to be stretched first before you just make the back problems worse. And eventually, I mean, I've seen so many people end up with back surgeries, and after working with them for a while, I learned that if they would have only learned the biomechanics of this muscle imbalance, they could have avoided surgery. And I hate to see that because we all know we don't want back surgery. Nobody wants to get a back surgery. So that's the big point here is, again, I'm not going to say don't ever stretch the hamstrings, but get assessed, make sure that they actually need to be stretched before you start doing that. So I want to go over just a little bit real briefly on, all right, well, if we're in this situation, we don't stretch the hamstrings, what should we be stretching? So again, looking at the muscle imbalance, we have that shortening here, we have the lengthening here. So what we want to do is we want to lengthen the quads and the hip flexors. That's going to allow the front of this pelvis to start tilting back into our neutral alignment. Once we're able to get proper alignment, we're back to neutral here. We can go in and retrain the hamstrings to work from this new length that they've learned. The lower back will start to calm down because those muscles are not being smashed and having to take over for things that the hamstrings and glutes are not doing. So quad stretches, hip flexor stretches, kneeling hip flexor stretch is one of my favorite ones. I don't think I have a single client that doesn't do that stretch. We'll do a video at some point on demonstrating all these stretches and kind of going through them. Do you guys have any other stretches you'd like to add to that?
I really like to take it from, again, the tension point. So that the quads and the hip flexors are often overactive and pulling into the anterior tilt. So, sorry. I like to do a contract relax activation. So I have my patients push into flexion with some resistance. It might be their hand, it might be a table or laying on their stomach, like a towel roll under their knee. So they'll push into that. That results in a muscle relaxation following the contraction. So you contract and then you relax and you lift into extension, or you move your knee backwards behind the hip, and that gives you more range of motion. So you're quickly training that muscle to lengthen. So it's a little faster, and you get a little more nervous system input that way.
Yeah, I like that. You're kind of hitting it from all sides.
Yeah, my favorite is always a classic. So just on your back glute bridges, but with a purposeful posterior pelvic tilt, and it's hard to describe, right? So you have to get with someone who knows what a pelvic tilt is, so they can kind of cue you and move your hips where they need to go. So that would kind of get right after that issue of getting that pelvis back in place. And side note, Dustin, you remember the first day we ever met? You told me to do that because I had back pain, and then 10 years later, we're talking about it on our podcast. So
yeah, that's where it all started.
Yep. Mm-hmm.
All right. Well, I think that pretty much covers all the main points. Obviously, this was our first podcast, so we'll get better at making sure we cover everything on the list. But we did get to most of it, so I'm real happy with that.
Well, we don't have to introduce ourselves next time, so.
Yeah, that'll save a lot of time. You guys talk a lot in the beginning.
Yeah.
Okay, so quick reminder, guys, go to YouTube, Symmetry Personal Training, subscribe, share, leave some comments on this podcast. Let us know what you guys would like to see next, different issues you'd like to see covered. And then on Facebook, Symmetry Personal Training, follow that page, share that page. That's where all the updates for everything will be. And then I'm going to post in the description all of these links, as well as the links for Katy and Dylan, so you guys will have an idea of how to get a hold of all of us and kind of keep up with what we're doing. We hope you guys enjoyed the podcast today. I hope you guys actually learned something, and this brings up more topics in the future, more questions. Feel free to reach out to any of us if you're in back pain and you kind of heard some of this today and thought, hey, that's what's going on with me. Reach out to us and let's see if we can't get you out of pain. That's the biggest goal, I think, for all three of us is getting people out of pain. So Katy and Dylan, quickly, if you'll kind of share best ways to get in contact with you guys. And again, I'll post that in the description as well.
Yeah, so if you have any questions, you can call or text me 214-600-8168. I will respond to a text way faster, so text me. And then if you want to follow me on Instagram, it's thefitpelvis.com, or not .com, because it's Instagram, the Fit Pelvis.
Oh boy. All right, so on our Facebook and Instagram, same thing. It's the DMI guy, all one word. You can email me at Dylan, DYLAN, the DMI guy at gmail.com. And that's how you can get in contact with me.
All right, guys. Well, thank you all for joining Symmetrically Fit today. We're definitely going to keep this thing going. Leave us some comments, and let's start getting into some more topics that relate to you guys. We'll let Dylan kind of sign us off, and then we're out of here until next week.
All right, everybody. Well, thanks for joining us on Symmetrically Fit. Until next time, stay healthy, and we'll see you soon.